we all come from different backgrounds. We all have different predisposition. We have all different types of brains. Some people, they have a vulnerable brain that the minute you introduce that substances, they hit and they become psychotic. Some people, they can smoke it and nothing is happening unto them. But we should not be able to go and now say, now I'm doing it, you can do it. You don't know where people are coming from.
Welcome to the MAGC Wellness Podcast. My name is Kavid Wings and I am your host. Today we'll be talking about something very, very interesting. We'll be talking about substance abuse and addiction. And with me we have...
Hello everyone, I am Dr. Lobese and I'm so excited to be here and be joining this wonderful conversation where we unpack substance and addiction.
It's your boy Kavid Wings. I'm here to listen about substance and addiction. But we're here to talk about substance abuse and addiction with Dr. Lobese. So before that, can you please tell us the journey of how you got to where you are now? First of all, who you are and how you got there, because you might find that some people have similar aspirations.
Okay, I'm Dr. Lobese Tabang. I'm a psychiatrist in training. I'm a diplomate in mental health and I'm a Masters of Medicine candidate at Sefako Makato Health Science University. My journey really began in Cuba, where I studied my medicine and I came to VERS to integrate, and I studied at Kgao Tsepong Hospital. But where I felt passionate with mental health, it was when I was at Bophelo Psychiatric Hospital in Mahikeng. That is when being able to see the diverse mental issues and mental disorders make me want to come and say that, you know what, I want to specialize and I want to help people to get back to the driver's seat of their life.
So, before we go any further, I want us to talk about, just a little bit before we delve into substance abuse and addiction, psychiatry, mental health, right?
Yes.
A lot of mental health care users in hospital settings, like these copies, Sterkfontein, they sing as matlanya, you know? Because when you do too much, like, these copies, right? And the only difference between people admitted and not admitted is that we outside. That's it, you know. So why does that happen? Because I'm a mental health care user,
I think one of the most things that people tend to confuse when it comes to mental illness and mental disorders is that they only look at the mental disorders that requires hospitalization due to the risk. But mostly it's going to be psychotics or bipolars that you'll see in the hospital. But what about the OCDs, those that are having like obsessive compulsive disorders, those that are having anxieties, those that are having somatic symptoms or personality disorders? You'll see them mostly in private. It's not that they are not there, it's because that the setting that we have right now, it is not really conducive, but it is not the one that you'll see mostly of them, you know. But when you look at you only see the tip of the iceberg in the institution or in psychiatric setting. But when you go outside, people are really going through the most. But I think as the lack of knowledge and understanding and the terminology to be given, so that they can be able to explain what they are feeling or what they are going through. And I think it's actually quite important that we need to be able to unpack that. When mental illness is such a, for me, it's really one of the most debilitating diseases, 100%. Because it takes you out of the driver's seat of your life. And it does not only impact you, but it impacts the people around you. And it impacts each and everything of your life. You know, it's actually quite more painful. But some of us are suffering from mental diseases, but we can still function and do that. So that's why people, like, they become higher functioning, but they have anxiety. They are using substance to self-medicate. They have OCD, they have personalities, they have cognitive disorders. But you don't see them in the hospital, you know, because in order to be admitted is because of the risk, you know, to try to get you back.
Said that we are found in private.
Yes.
Your personalities.
Yes,
We are
yes.
found in.
We are
guys,
found in private.
catch me in private. Because I'm a personality, right?
Yes.
And.
Yeah.
And people will say, but you don't look, but your personality, but, right? We are sleeping in hospital beds in private, okay? So it doesn't look like anything. But I know what a lot of people, because we know about anxiety and we know about, what is this, bipolar and skits and. But I think very few of us know about addiction, one being
Yes.
a psychiatric.
Yes.
We
yes.
don't. I mean, when, we really don't, because we see it as a choice.
Yeah.
You are choosing to be addicted to.
Okay.
That's not what I mean. You're choosing to be addicted to alcohol. You're choosing to be addicted to drugs because you started the drugs.
Yeah.
We don't see it as you're now using it to cope.
Okay, I like, let's look at it. There is a bi-directional relationship between substances and mental illness. A lot of people that are having mental illness, they will suffer from substance use disorders or addiction. And the people that are using substances, mostly they will end up with mental illnesses. I always look at it this way, that what started as a solution has now become a problem. Nobody starts substances because they want to get addicted. They were just going into a borrowed happiness that has now become a torture.
It was a solution to the problems they had, only for it to turn into a problem.
Or recreationally. You're out with your friends and they're like, hey,
So you have to be able to unpack what is it that you were trying to solve, that you took a substance to become a solution into the problem that you are facing. When you begin to unpack, then you tend to realize that people were using it as a self-medication. I don't know, many will start, I started as a peer pressure. I always say it's a peer pressure in the early ages, but at a 20-year-old and you still say it's a peer pressure, let's unpack that. What was the gun? Did they put a gun on you and say, you take this thing, or
you're not cool.
Or you're not cool
I feel like I'm in a therapy session.
Yes.
So also, can I wanted to maybe talk about it, like I hear you even said substance use disorder or addiction. So what is addiction? What is substance use disorder? And then I think I saw somewhere where addiction is no longer being used. So can you please clarify on that, those terms?
Okay. Yes, I think that's a very interesting thing to ask about. And I think it'll kind of like bring this home. What people think addiction is, because we don't use the word addiction in psychiatry, we use the term substance use disorder. When you're gonna tell people like, you do have a use disorder, they'll be like, no, I just drink only on the weekends, or I just smoke there and there, I'm doing it occasionally. You only need 2 symptoms to be diagnosed as a use disorder. You need only 2 symptoms. Like, okay, does your drinking impact your finance and your work? Yes. Okay, do you crave it? Yes. Before we even ask many questions, you are already classified. You are inside. You are addicted.
Yes,
I think I'm telling the truth.
I want to sit down with myself.
It's the only difference is going to be the severity of the use disorder. The addiction really talks about the biochemical imbalances that happens on the brain and the clinical presentation that come with the cause of the substances. So when you come to substance use disorder, I'm telling the truth. People like, I started when I was young and I'm still using it. That's a criteria. It's the use of something more than the
Specific amount of time.
Yes.
Can
the
we
time.
please go through? Well, you know what? I want to come back to so many things. What does affecting your finances mean? Does it mean like you plan to spend, say, 2 rand and you end up spending 10? Or does it mean you had 10 in your bank account and now you're on 0 because of the substance?
Remember,
or you're borrowing money?
Yes.
Or like, what does affect mean?
Remember, when you start the substance thing, it's a choice, and every substances that we use, there's a similar neurotransmitter in the brain that it activates. We have something we call natural highs. Those are the joy that we get from natural things like sex, like food, and also the pleasure or exercise. They go through a certain pathway that it will make you to come back so that you can get the same joy. Substances bypasses that. It goes into your brain and gives the surge of the dopamine and tells the brain that I can get happy without having to go through the process.
I'm all you need.
Yes, I'm all you need. So it starts firstly as you start now where you are now going to buy it. Then it's going to it's going to disrupt the mechanism of how we do the pleasure reward system. Then you're going to go from now going to buy, but to come to the compulsive. Now I need it. I don't care that, you know what, I'm suffering financially. I'm no longer even having
Yo,
to plan.
you
I
know-
gotta have this thing now.
It's so common. You know why? Yo, today I deserve a glass of wine.
Yes.
That's that.
Yes.
It's that it's
Like
that
I've had such a long day.
Yeah.
I've had such a long, and you know what? I don't want to lie. We've normalized it because, you know, we rationalize it like, as long as you don't get drunk, you are allowed to have a glass of wine daily.
Some people
Right.
even want to get drunk. I've had such a long week.
Bophelo bo
I
busy,
need, like you said, I
Rapowa.
need it. So I need to go out today. So it's
Yeah.
Not I need. I would like. I feel like wedding.
you know why I use the word need, because you make sure you go outside. That's
okay.
that's why I say that.
Or drinking
Yeah.
those.
And I think that's one thing that you said, that in the beginning when you start using substance, you are the driver. But as the time goes on, you get out of the way. The substance is the one that drives you. So it is the one that controls what you do. It is the one that controls where you go. It is the one that controls everything. And that's where the impact will now start coming. You know, last year we have a significant rise in the states where, like, we South Africans are using alcohol, like the rise of the money that was spent of alcohol. I sat back and I asked myself, and I said, if you get to be able to ask your question, before we came to say that why are we drink a lot of alcohol, one should come back and say, why?
Yeah. Any take? How? Why do you think? I'm trying to think about it.
I'm also thinking, you know what? From just a very, because I feel like this is one of those questions where you need to sit alone
And ask
on your
yourself,
bed
why?
with a journal, and you're going to, you know. But just off the top of my head,
Yeah.
I think number one, it is very normalized. You know,
It
we
is.
saw our parents drink.
So it's a
every
cultural.
Friday. It's cultural. It's almost like December. You know how December
Yeah,
is cultural?
yeah.
As soon as it's 1 December, you know it's drinking season. Should it be? I mean, other cultures don't really have December. It's just as black people, if you're being honest. Right? We also see our friends drinking. When you go to Groove, I mean, when you order, you know, what is this, passion fruit and lemonade? Hi, Bo. Hi, Bo. Do you want to go to Groove or not?
I think
You
it's
know?
because of our
So-
setting. You know, we have
But there's
so
people
much.
that go to Groove and don't drink, and they have fun.
Yeah,
and
but
they
the
go
people,
home.
the stats that he's talking about is the people that do drink. Why do they
Yes.
drink? I think it's because of the access that we have.
Yes.
We live in a country where alcohol is so accessible. Like, it's so accessible. If you would compare people that use other substances compared to the ones that use alcohol, alcohol will give you numbers. Why? Because of where they can get it. If you, maybe let's say, for argument's sake, cocaine, we don't have much people using it because, okay, it's expensive.
Hey, we do.
Number
though,
one. And number two, no, we don't have much because people don't know where to buy it. That's
And it's
so the
expensive.
access and the expensive. So yeah, so our financial statuses and the access that we have to alcohol. If I walk now, I don't know, there will be alcohol somewhere. So that might play a role.
I think
as to
just
why.
before you continue, Doctor, you know, I think also as a millennial, thinking about the Gen Zs, now exclusivity is such a big thing. If you're drinking Ace, you are the gal. If you're drinking Don, you are the girl. You know, and I think that's what causes also the rise in what is this in the money that we're spending, because I know with people that club, if there's bottles, it means you're doing well in life.
Yeah,
You know, we
yeah.
associated with financial standing or societal standing. So Yeah.
I think the most interesting thing is that when you look at the country that we live in, when we have such different factors that are so conducive for a poor mental health. We live in a country where there's economic problems, there's a high rise of unemployment, there's a lot of diseases, availability of substances, and you see so many people. For me, I'm just when I maybe it's just me. I just said to myself, I said, maybe if we look back from the accessibility and the status and say that people are trying to numb the pain that is on the inside, and they are not wanting to face the reality. Does alcohol make you forget your problem? That those 3 seconds, you've forgotten that you are, you have responsibility. But when you go down, they tend to come back. And alcohol is one of the most substances that has a lot of mental disorders. And actually, drinking alcohol, it is actually one of the risk factors, especially for depression and suicide. A person who's depressed and drinking alcohol and trying to commit suicide, it's actually much of the highest risk.
Really?
Are you listening, guys? It's not taking away the pain. It might be adding onto your problems.
So people, they try to numb the pain, and there are certain substances that we call them gateways.
Okay.
So something like cigarette. I started with a cigarette. I started with alcohol. Those substances, they begin to just to stand at the door to open up gate for more other substances to come into it. Remember that when you use a substance, there's a level we call tolerance. Now the body can tolerate this thing. You started with 2 Savannah and you went out. Now you need at least 6.
So being out at 2 is a good thing.
Yeah.
It means
No.
So if one glass of wine takes you out, you are doing well.
No, what I'm saying is, when you start, when people are starting, they start with this 2, but now they only realize that okay, 2 is not getting me there. Then now they increase. It's only a matter of time now they want something more. Most of our young people, I think yesterday I was in the hospital, we had a 15-year-old who came in and was intoxicated with cannabis, and she was very psychotic. One will look back and say, at such a young age, you've already attempted to use this. It talks about accessibility and everything like that, but that is beyond
our control.
My control and context. But when you look at these children that are starting to smoke cigarettes when they were young, we'll talk about the impact of the cannabis, especially in mental illness, because I think it's something that is trending now, and we need to unpack about that. So this cigarettes, this alcohol, it kind of like prepares the brain that when the other substance now come, it's gonna potentiate the effect. Then now you want to keep on getting more and more. Most of our users, they are not only using one thing. They have now come to the point that they're using even more. They started with Savannah, then they went on to something else. That's what I'm saying, that we need to come to the level of saying that, let me just ask you, why are you drinking? I'm just having fun.
Yeah.
Well, it might start as a fun, but now it becomes to be a coping mechanism.
Yeah. We need to, I think the reason why we overlook that question as to asking people why are you drinking is because we already think we know the answer is no, he's drinking because of peer pressure, when we actually need to ask why.
Because you look, a lot of young boys that are suffering from anxiety disorders, they will take it, and alcohol kind of like suppress that anxiety. Imagine if we had gotten to the root and deal with anxiety, they would not have even went to the point of using alcohol as a time to cope and to calm down.
Is there a term such as substance intolerance, where as soon as is it what you're describing now, where as soon as someone smokes or sniffs or drinks, they become psychotic, or they, I don't know, is blacking out substance intolerance?
I think when you come to a psychotic, and a lot of people do saying that there's nothing wrong with weed, everybody's smoking weed, everybody's like, you can smoke it and everything, nothing is happening to me, all you guys are lying because of this thing does not cause psychosis and everything like that. Cannabis is one of the most studied substances when it comes to, it's one of the most studied substances, especially in link with the schizophrenia, one of the most debilitating mental illness. You know, the thing is that people, they tend to forget that we all come from different backgrounds. We all have different predisposition. We have all different types of brains. Some people, they have a vulnerable brain that the minute you introduce that substances, they hit and they become psychotic. Some people, they can smoke it and nothing is happening unto them. But we should not be able to go and now say, now I'm doing it, you can do it. You don't know where people are coming from. They might have a genetic predisposition where the parents and the grandmothers or the fathers, they have a risk for mental illness. Remember, in order for you to have a mental illness, the multifactoriality of it, environment is one that plays a huge role.
Yeah.
Yeah.
So just to, can I please try to summarize and tell me if I'm wrong? Just to clarify what you were asking, substance intolerance, it's not because now people would think because they are not psychotic, it means they can tolerate. No, substance intolerance is intoxication. You are not tolerating all there. So when it goes to psychotic, that's what he was explaining. It's something else. It's not about you being able to tolerate or not being able to tolerate. Those are two different things. Intolerance and psychosis. Those are two different things that should not be confused.
Because when you go into the term of psychosis literally means that you're out of touch with reality. It means that you have lost the touch with reality, you know, and it goes even manifesting by hearing voices or seeing things that other people cannot see, and having this sense of beliefs, maybe that, you know, they're out to get me and everything like that. It kind of like it like, for me, I feel like it just like separates you from the reality and put you in a certain world that is not here.
From the different substances, alcohol, weed, nyaope, maybe crystal meth, maybe it's a crystal, yeah. Okay. From those different substances, which one would you say you've seen to cause psychosis the most?
Well,
Okay, can they all cause psychosis?
in different degrees.
Oh.
I think in different degrees, because all of them, they can induce mental disorders. But so they can induce different mental disorders in different state.
Okay.
Certain can cause a mental disorder in withdrawal. Some can cause mental disorders in intoxication. Like substance like crystal or cocaine, they can induce bipolar, you know, whether in intoxication. They can even induce depression in a withdrawal state. Alcohol, whatever, in maybe in intoxication or use disorder, can either induce bipolar or depression. So all of them, they have a different degrees on how it causes mental illness. I think I think for me, one of the substance that really breaks my heart and the use is nyaope. You know, that one is very debilitating, you know. And the reason why, I had a young boy who I was seeing, and he said, no doc, I don't use nyaope, I buy codeine and mix with Sprite. So it kind of like is on the class. But I'll say that, but the same content you have in codeine and the same content you have in nyaope is opioid. It's all the same. So someone who's using nyaope and using codeine, you guys are using opioid.
That is so scary.
I'm telling the truth, because that's where,
very
the
scary.
content there is heroin. Yeah. So the content of nyaope is, the main content is actually heroin. You know, they will all take all these other ARVs, baby soft, whatever I don't know what they use on the screen TV. I think some people say they take something from this
TV. I've heard about
but
that.
it's just only
You know, when you break, you see
Yeah,
these lights,
the
also
lights
these
or
lights.
something.
See, there's that powder.
yeah.
Because lot of tlhokofala.
You know, so but that is an opioid. You take codeine, it's an opioid, you know.
Can I just say
Yeah.
something?
An opioid also.
No, wait. Just without. Is that fine? Just without judgment. This is a safe space, ne?
Okay.
Now, I remember when I was in varsity. I think this is probably why cough medication doesn't have alcohol anymore. When we were in varsity, we have a little Wayne. You know when they used to rap with like their glasses.
So you're old, huh?
You
know, you are in varsity.
But codeine was very normalized, you know, because Lil Wayne was doing it, and in our minds, you're not really drinking alcohol, and you would get a little dizzy, you know?
Yeah.
And then when you grow a little bit older, still in varsity, you realize that, oh, this is actually really detrimental. And that's the time that little wings started getting sick. And they were like, no, it's because of. And then now we were like, oh, okay, this thing can make you sick. And then
I think the problem with opioids and the reason why it's such a big it's a toughest drug to let go because of the mechanism on how it works in the brain. It's so fast. It gets fast to the receptors, and it is going to cause the action right now. You're gonna get high, intoxicated, but when it leaves, the withdrawal symptoms, they become so unbearable that you need to go and get more to get there. And now the addiction or the use disorder kind of like
where it comes in.
as cemented because the use, it goes on. That's when we talk about why these boys are now in the Bluetooth and everything. Like the withdrawal symptoms are so severe that they want to come in. And if you have someone who wants to get through nyaope, yeah, they want to be able to let go of it. The treatment is different because you
when they
need to be
chain
able.
them or something.
No,
Even
No, like guys, ne, please comment, ne, please in the comment section. I promise you, there's rehab centers that obviously aren't like clinical. They're just there to make
oh,
sure.
you're talking about rehab centers.
Yes, and then like especially the bukereke, you know, like church-based ones, they chain you to the bed until you'll fight, you'll sweat, you will get sick, but they want you to be steady. But I think people break those chains and they get out the window because it's just so painful. It's too painful.
I think maybe when you when it comes to the management of substances, ne, always look into it in different levels. You know, I always say that if you look at one section like the social, that's what they're trying. The parents are tired. Guys, even someone with a substance is tiring. You care for them till you reach compassion fatigue. You know, I've had a brother at home in Kgao who was using substances. You know, I know how it's like to live there. You have to hide things at home. You have to do it's tiring. You can see how parents are going there, and sometimes the rehabs and everything, because in order for someone to do rehab, they have to be wanting to go to rehab, and I think maybe that's why the parents are resorting to all this no smoking and churches, rehab and everything like
And
that.
chains.
And chains. But
Can we also talk about that the steps of management if someone is trying, let's say the ones that are willing to change, what are the steps that they can take for them to be free from substances?
I think, you know, if you're going to manage substance problem, I think is always, for me, I always say that don't get into a hurry to manage a substance without taking a good look on what is the real problem. Because like I said before, why was the substance used in the first place? You know, because most of the time we have something we call in psychiatry dual diagnosis, which means, like I said when I started, I said that people that are using substance are at a high risk to have mental illness, and those that have a mental illness, they were high risk to use substances. So there is this relationship. So most of the time we want to manage one thing without dealing with the other. We are not going to be able to win. You get it? If I'm going to be able to put you here, detox and think you're going to do it, if I have not yet dealt with why you went there, it's only a matter of time before life happened and you go back there, because that was the solution that you know. The brain knows where to get help for yourself, you know. And I think that's why if you're going to manage, let's look at all different levels and
holistically.
holistically, you know. And certain substances you cannot just manage it by cold taking. You know, you need very nice steps how to deal with the withdrawals. Like for example, nyaope. For the people that are taking nyaope, we need to put them on substitution therapy. There are certain pills that they can take, you know, so they can be able to deal with the withdrawals, and so that it can aid them to be able to stop smoking.
So someone
You know.
with nyaope out there that maybe is hearing about this and then they want this medication, is it accessible to them, or what's required for them to get?
Well, I think it will depend where you are, but I think in Gauteng, Gauteng province has different centers, and I think is it Sanka? I think it's Sanka. Yes, I think Sanka has. I know in social Gove there are certain places where they offer assistance with the substitution therapy. But I feel like if you have any problem, SADC has a lot of different platforms where they can refer you to be able to. But thank you when you mentioned that thing. The first step is to come through you, and the reason why it has to be you that want to change. You are the one who took the first step to get there. If the change comes from within, then the intrinsic motivation becomes solidified, other than when it's a mother or a parent or someone who wants you to change. Now the dynamics becomes different there. You will do it because they want them. But if it's something that you wanted to do, that's where you can take you through.
You know, he's coming through with so many concepts.
And let me tell you that I have in my head now, I have 3 questions and I don't know how to ask them.
Yeah.
So, the first question that I want to ask now is, you know, we do your October and we do your guys, I'm reflecting today. And sometimes we start this whole day one. You know, you get so like, you know, you're like, I don't want this anymore. This is just, it's dumb. Because I know it's called anxiety. I've had anxiety for 3 days.
Anxiety.
Anxiety.
Oh,
never heard of
anxiety.
Like the anxiety that you get after drinking.
Yeah, like
Right.
no more because I'm
Is it withdrawal? Can I ask?
I'm
Is
done
that
with-
withdrawal? Can we call it withdrawal?
It is withdrawal because now you're
Anxiety.
anxious. And now,
it is
remember also you're
withdrawal.
dehydrated. That's
Yeah.
why you're hungover. You're anxious. You look at your bank account. You're like, oh, what was I doing? Because I was generous, you know.
Yeah.
And you're thinking, you know what? I clearly have a problem. Day 1 till day 6, which is probably like a Friday.
Well, there is a mode of therapy that we use, especially with substance use disorder. It is called motivational interviewing. So in that way, a therapist is able to assist you. Listen, change. In order for you to change, in order for you to be able to change, there's always this ambivalence inside of us that I want to change, but I need to stay. And I want to change, I need to stay. We need to be able to enforce the intrinsic motivation that are for change. So most of us, we want to lose weight. It happens every general. I'm leaving alcohol, I'm leaving this thing. But why is the change not maintainable? We need to be able to look at the thing. Is the motivation inside? I always say that when the powers that are pulling us up are greater than the powers that are pulling us down, there will be a moment of lift. So if the intrinsic motivation within that need this change is much more greater than the pain or the necessity for me to stay here, then I'm going to be able to reach a level and I'm going to go up high. As a psychotherapist, I'm going to be able to assist you to go through that stage where you think, I don't want to change, or like, I think I need to change, or I'm ready to change, and how to maintain that thing. This is a stage that I love during change. Is called a relapse. I think people, they look relapse as a way of like, no, I messed up and everything. No.
I failed.
No. Relapse is part of healing. Relapse is actually more important because relapse helps you to go back into life and say that I had relapsed because there was certain weakness in my stronghold. So if I can go back and fix this one, it means the next journey is going to be much more, because life happens.
Can you take us through those stages? Can you take us through those stages? Like you said, the stage that you like is relapse. It sounds like there are other stages. Can you take us through them?
Yeah. So because you will go through pre-contemplation where like get sharp and nothing. Yeah,
that's the first stage.
Yeah, that's the first. Then you start contemplating on wanting to do and wanting to change. I think I love motivational interviewing so much as a therapist because in that day, a patient becomes an expert because they are the one that took this drug. They are the one that knows how they go into. So they lead the therapy, just there to collaborate and take the journey with you. So most of the time is to be able to be on your side and help you to answer those ambivalence. Do I really need to change? My friends and everything, because forgive me to use this word, the demons inside you, they'll be like, honey, ngeke. So you are.
Be outside.
What do you
So
mean?
What do you mean? Oh, I want to be outside, but how can I be outside without?
Yeah.
But that is caused by this ambivalence that we have inside. Like, I want to change my news, like you want to lose weight, and all of a sudden, space, what do you call this thing, your favorite ice cream goes down. People are now starting to bring you all the presents, and like, oh, the devil is a liar. Because you want to leave the drugs, and all of a sudden your friends are starting to give it to you, everything is starting to come. We need to be able to learn. That's why I'm saying that if my motivation to change is much more higher, it's much more put in by the reason for me to stay, that's now you're gonna move to action, or you're now putting into the action. But after now you've involved in the change, how do you now maintain? So during the maintenance, life happens. You go through life, things happen in life. You might lose a job, you might lose a relationship, and guess what? The minute that thing happens, it takes you to that stage again.
Default settings.
And I feel like, what, if only I had that medication to fix me.
So I think it goes back to the reasons to being honest with yourself as to why you are taking this medication. Like you were saying, you might find that a person would think that they are taking substances because of peer pressure. That's their reason. And they start changing. They are now at that stage where they take action. So now they have that motivation to go to overcome the peer pressure. They take the action to stop, and then they lose their loved one. They go back to their drugs. So the question comes back, is it really peer pressure now?
It's a coping mechanism.
It's a coping mechanism.
Yeah,
So,
what I wanted to ask, and this is something that I've heard women talk about, mothers rather, right? So say the person, before falling pregnant, they smoke, they drink or whatever. When you find out you're pregnant, you're able to cold turkey everything. I think because the motivation is
higher than the drug.
And then I swear there's actually a particular woman that I know who is like a chronic smoker. But during pregnancy, she has a few kids. During pregnancy, she will not smoke. During breastfeeding, she will not smoke. But as soon as she goes back to smoking like she didn't stop.
I think we undermine the power that we have within. I think we undermine the power that we have within. To be able to stand up against life challenges. A lot of things that we do in therapy does not give you anything. Therapy is for way to help you to discover the giant within that is able to stand. I think life slaps us to such a point that we forget that I'm the main actor. Steering, man, steering more. Yeah, I'm the main character. Steering has a losey. Like, even if they can go through hard time, we know Oxalayo. Van Damme is good. Chuck Norris. Steering has a losey. But when we let go of the character and we become supporting cast in our own movie, then we let go of that. Let go of that.
Yeah, I want to go to that stage, your favorite one now, the relapse stage. Is there hope for people who relapse?
Oh, definitely. And I think, and the reason why I love it so much is because it cuts through not substances, cuts through life. Have you ever been in a toxic relationship and you've made it, you've left it, and all of a sudden it's like a whisper from a devil saying, go back there, and you find back again in that relationship again. You're like, oh, what happened to me? But I think
devil is a liar. The devil is a liar.
But I think then we all conjure about on what happened. I should have not done this thing. I should have left. But we forget on the beauty of reflecting and said, what brought me back? What is it that I still had that invited me there? You
Sure.
know, we need to be able to go back and say that, what brought me back there, I'm going to deal with it and sustain. Because it's not like a cycle. It's a continuous cycle. I can relapse, and after that I can go back to maintenance. Then I have to go to pre-contemplation. I can just relapse and go back to maintain. Why? Because I've realized that whenever I'm sad, this thing happens. So
Whenever he calls, I answer and I pack a bag.
And I pack,
So don't answer.
Yeah, you
So don't
maintain.
answer. Just go. Actually, you contemplated.
Yeah.
If I-
So now you
if
just
I
need
say
to maintain
hello,
the not answering.
then- So you are cutting out what? Hello.
When
I'm learning. I'm
So
learning.
I'm one person who says that I think in most instances what we are trying to do, we're always looking on the outside and begin to blame people for certain things, you know, and we don't take that accountability. I will say that, you know, you don't have to block them. You need to grow to such a level that their call will not require,
Move you.
will not have a, you have in a clinical term will say that you need to be desensitized from them. That spark that you need to get when they are around you, like, oh, here's my butterfly, like their
And that
presence.
thing
No,
is anxiety, guys. The butterfly means
Where you
you are
get
not
to-
stabilized. Be with the person that doesn't give you butterflies.
no. Well, I know that, but sometimes
Like-
butterflies
Guys,
are
when you
good.
get to a point where you feel like you need to use the substance, it's beautiful, like you were saying. If you get to a point where you don't need to, where your friends that are using it, calling you, are not, you know, influential in your life, it's all up to you. Né? I just wanted to come back
Yes.
to
No, I actually just wanted to ask something. I remember there was a time where, you know, women are obsessed with, everyone actually is obsessed with good hair. And it was the time where cannabis oils and hair food and were starting to, you know, the more I talk, the more I realize how old I am. Yo. So they were still being introduced because remember, back in the day, cannabis was, you know? So, or people would get cannabis in secret, crush it, put it in hair food, and you wouldn't tell people, you know? So I remember I discussed this with my psychiatrist. I was like, oh my goodness, this is actually what I want to try. And she was like, for the love of everything good, do not, because of your she's like, the fact that it goes through your pores.
Yes.
That might actually trigger a psychotic episode. I was like, how? How does that work? It's going through my pores.
Yeah.
So she said you can't use any cannabis infused anything.
I like when you said that because of me, you know, and I think because people it comes to the fact that you guys are all lying. This thing I've tried is not working. It's not working to you, you know. It does not cause psychosis to you, but to someone it might, you know.
Yeah.
It does not do anything to you, but someone out there has a mother or a grandmother that was once had a mental illness. That if you put this thing in, it will invoke the genes and lead them to institution. When you look at these young boys, they'll say that, no, my friends are smoking, nothing's happened to them. Yes, nothing's happened to them. But you, in your family, there might be a gene there that is
Mara
going to
also,
work.
so
It's always...
my families are actually not the problem, but
No, like, you can't change where you come from.
of course.
But only...
what do you want to say, Kgao?
No, because I'm
About
thinking,
family.
no, wait. Just hold on. Because I'm thinking you're probably predisposed to addiction because of multifactorial.
Yeah.
But part of the factors are your genes.
But yes, because that's...
So who do we blame? That's where I'm.
no.
Because that means my child,
Yeah.
I'm gonna sit down my child and say, when I do not even try cannabis because of me and the people before me,
Yeah.
it will.
But I think you need to realize something about mental illness. Have you ever noticed that most people, they can grow from the family that were predisposed, but they live a better life?
Yes.
Why? Because there are a lot of things that are taken into consideration. Some people, they have more protective factors that are able to make sure that it will stabilize them. That even though mommy had bipolar, mommy had depression, like you don't even have to go through because the protective factors, they outweighs everything, the precipitants. But imagine now if maybe you come from a family of mental illness, then all of a sudden you are unemployed. mojolo wa go nyesa.
Hey.
This thing is happening. There are a lot of things that are going on that are happening. What's going to happen? You know, I think I was speaking with a different women's one time, and I said we need to come to the culture of in building the resilience inside. But sometimes that resilience, it will need you to be in an environment where the protective factors are much more higher. So you can have your child who live a beautiful life, you know, and they'll live a beautiful life even though mommy had predisposed to this thing, because they live in a context where the protective factors are much more. But let them go through life struggle when, and they start involving all these other things, it can complicate things.
So it's though the risk that she's afraid of with her child, it's preventable.
No, genetics alone cannot lead to cause mental illness.
Oh,
That's
they
why
need
the
other factors.
the cause of mental illness is multifactorial. Yeah, it involves a lot of factors that are coming into play in order to cause mental illness. Yeah.
So with me, you know, I grew up in a good home, and with BPD, it's because of trauma. What? I didn't have trauma growing up. I don't want to lie. Shout out to my mom. I didn't have trauma. Maybe I did, but I'm not aware of it. After 8 years of therapy, I did not. Right? So I had sudden seizures that caused, let's just say, a little bit of damage in the brain. And that is why there's so it's more biological on my side. So I think because I'm already predisposed, and there's also that element of biology, and because of that, I'm actually scared of having more children. But lest I digress, how then do you know if, say, you don't have genetics but it's biological, that if I drink I might actually not have tolerance towards this particular thing? How do you know without trying?
Well, I think most of the, you know, I think any psychiatrist that you'll talk to, they'll say that sometimes it's better not to start. Sometimes it's better not to start, because some people, they were just trying to let me just taste, and the taste became a hook and a bait that still today it was not the one to let go. Sometimes it's better not to start.
And apparently there's substances that hook you with the first try. I don't know if it's heroin.
It's heroin.
Heroin.
The way I spoke with the receptors.
Yeah.
Got in on the receptor. Then immediately when you let go, the withdrawals, they're like, no, you need to go and get it back so that you can get
From
to
the
that stage.
first try. That is insane.
Definitely.
Yeah.
You know.
So guys, don't put things in your mouth or in your that you don't know.
If you already, have those things in your system, you can still recover. That's, I think that's also
And if you
important.
relapse,
you can still recover again.
and if you need help, if you don't know if you're addicted or not,
Listen, you need to be able to take charge of your life. Be able to look back into your life and say that, okay, I have failed in this thing. I have started this. And since I have started this, I have control to be able to move here and to go forward. Be able to come there. As long as that you are living, you can be able to make a change. Take that first step and go and seek for help. When I said about motivational interview and psychotherapy, sometimes you need somebody who is well trained and specialist to be able to say, no, bruh, I think I can be able to take you through that journey. When you fall, someone has to be there and say, you can do this thing and you can go forward. If you need treatment, because I said most of the substance, they just self-medicate, or they help us to deal with the problems that we are dealing on the inside. Listen, if it is a solution, there is far much more better solution that is not going to damage your liver, your mental health, even your brain or your body, or even impacting your family. Sometimes it's all about going there and getting the real diagnosis. My mentor said to me, Lobese, most people don't get the privilege to see a psychiatrist and to be able to get to know what's wrong. And I get so sad when I realize that people, they can live their entire life not knowing that the problem, and they're only trying to self-medicate the symptoms. And it's until when you meet somebody who can be able to say, this is where everything began, and this is how everything has led to. Now, from this on forward, let us now change the narrative and change the story. And that's when you come to seeking help early. It is not that people don't seek help early, it's because the problem was not realized early. It's one thing for somebody to tell that there is a problem, but it's another thing when I'm able to realize that there is a problem on the inside of me. Give people light and a chance to discover the problem within, because that is the one thing. I like what you said, that some people will be like, they can go all no smoking because they are pregnant. What is that drive? You know, what is driving them? Because they don't want their kids to be born in a certain way. You know, we can take that and use it as a motivation to get our people from all of this thing.
Coming now to that, right? Just being self-aware, support. I know there are times, maybe it's just on TV, but I think we've been exposed to intervention, like family intervention, friends intervening, where you come into a room and they're like, "Sit, we think you have a problem," you know. What does that do to a person? Does it motivate them even more? Does it make them feel judged? What does it do?
Is it necessary?
Is it necessary? Does it help? And also, if you realize that someone might have a problem, how do you then address it in a supportive way?
That is really interesting. But sometimes some of us come from a highly expressed emotion family that are hostile, they're over involved, they are running their life, and their mothers, yeah, you need to do this, you need to stop this. Let me tell you something. We make decisions on our lives based on the options that are available. And you keep on making the same decision because the options are the ones that are available. So what you need to be able to do, somebody must come with an alternative option so that it can be able to show you that there is a change. The reason why a lot of intervention do not work is because people, they don't see that they are a problem. Let me tell you something. If the whole family comes back and say you have a problem, what rises up inside of you? The defense. Yeah, you the defense mechanisms tend to be so strong, and sometimes we defend ourselves so much to such an extent where our defense are even hurting us, because you want to protect self. Self will always want to protect self. But the minute self can come and say that, you know what, I have an insight to know that there's a problem here, that's when you can be able to say, I think the people around me, they are now telling the truth.
So how can you advise, let's say, a mother or a family how to approach this intervention without the person feeling like they are being attacked? You know, people will defend themselves because they feel like they are under attack. So how can we approach it?
That I think that is very interesting, and it's important. I think it's always let if maybe it's a child or a brother and everything, let the change come from them. You know, let the change be able to come from them. Let them be the one that wants to change, and you can do that in different ways. You know, be able to use kind words, be able to help them to see. You know, if they can just be able to see what impact does this substance does to them, what impact does it does to their psychological, what impact that this thing does to the community. You know, because what most of the time when we want to hurt our parents, what do? We destroy ourselves, because that's the more greatest pain that they have. But sometimes you need to be able to be kind with them and be able to show them piece by piece. As the time goes by, it will potentiate. I'm telling you. You know, like, do you know that this thing is not dealing you well? Don't shout. Just plant the seed.
So,
Yeah.
you know, we are aware of, I mean, outside of alcohol, but like your crystal meth and nyaope, we understand that if you take a lot of this, or if you depend on it, then that is definitely substance abuse, right? Or misuse, rather. So, what about things like prescription medication? Because now you have pain and you're thinking, and they say drink 2 of this, you're thinking, let me drink 6 because I'm in too much pain. And now you realize, oh, this actually works. And then that's what you do on a regular. Or you take it for, I don't know, sadness, or maybe you take it to sleep, but now you can't sleep without it. Yeah.
I think when it comes to addiction to prescription drugs, it comes even with me as a professional to psychoeducate. I need to be able to teach my patient that I'm not gonna give you this thing for this too long because it has a risk for addiction. Like we have people that are now abusing benzos because they're using them to you started using them to treat anxiety. You were wanted to use them for 2 weeks, but now they come to the point where now they have dependent on them, and now they are no longer consulting you for the pain. They are demanding that you give me this thing, because if you do not give it to me, my pain is not going to go away. And it's very difficult because of because it's a prescription. You need to learn how to de-prescribe, which means that it's gonna go through a slow tapering down. But the patient needs to be able to know that sometimes our minds are built differently. If my brain said that I'm in pain, even though the organ is not in pain, it's going to be in pain because of us. So certain pain, they become psychogenic, they become psychological. And if you can just deal with the mind and restructure it, sometimes you will deal with a lot of the problem. So dealing with the prescription, I know it's not only benzos and a pain medication. Even in our specialty, we know these medical students, there's a certain medication that they like to abuse and thinking that it's going to make them intelligent. I think don't say anything. I think maybe so I don't want to go into.
But do you not think you should say the name so they know that people?
No.
I think maybe
You don't
because
think
of
so?
the ethical guidelines.
So you can't say that.
No, because you'll be promoting the brand. So I think on and on, you need to be able to educate.
Also, remember, you know how you mentioned in the beginning of the episode that some mental health care users are not admitted. So when you are giving them ideas, you see now you are informally prescribing to them.
Yes.
Oh, that
And
this
now
thing
you-
is going
you
to
want-
be
Yeah,
so then you become an enabler. But I think
Yeah.
our people, they need to be educated. The solution is always there. The solution is always there, and we need to be able to know that rather than going on and trying to get a quick fix, just know that there is a solution. Sorry, there is a solution that is going to help you. Get a professional. So my apologies, but get a professional help. See someone. We don't have terminologies to be able to describe how we are feeling. There's a difference between anxiety and anxiety disorder. There's a huge difference. There's a difference between depression and a depressive disorder.
Can we highlight the difference?
So when it becomes a disorder, it is when it persists more than the certain duration of time, and it starts to come with certain symptoms, and it impacts your functionality. We all want to go wish sometimes, but the minute go, I'll pay. So it's I
And
seek
this is
help.
a real thing.
Seek
There's people
help.
that go
Yeah.
long.
No.
Also-
Like you can't be at Uartambu for the whole month. What departure? I'll fly. Seek help. Seek help. Yeah.
You know, there's those people who maybe need friends. How do you feel about people that, so I feel like people don't seek help because they don't know they have problems. So my immediate solution to that would be, maybe if you have friends that can identify those problems, they can encourage you. So in terms of picking up that we have problems, what can we look at?
I think we have lost a lot in because of the rise of social media. People, and especially when it comes to mental health, Like I said, that a lot of our mental health, mental disorders are not the one that you see them in a hospital. Everybody is, I'm having an anxiety, I'm having ADHD, I'm having OCD, I'm having bipolar, but they don't really know those diagnoses. They don't know. For an example, I can say someone who said OCD, they don't know that OCD is one of the most debilitating mental illness that you will never even want to have. It's very debilitating.
They think
They think it's
tightly
been
into
tied in everything. So I think the terminologies that have been incorrectly used. Because someone will be like, no, I'm an antisocial. But antisocial, it's a personality disorder. Like the playing around incorrectly of the terminology has led people that even when they are suffering, they can be able to normalize it because they don't think that I'm not in a psychiatric hospital, then it means I'm okay. But
So for someone to realize that they are not okay, what can they?
yeah, because when you said to something like you for me, okay, the one classic sign that I always say that you need to be able to look that I'm not okay. The minute when you are not yourself, the minute when you can see that I'm not the same way that I used to be, and even the people around me, they said to me, Tabang, you have changed. There are certain things that you used to do, but you have moved away from there. That's a red flag. It kind of like you. Let's investigate what happened, why you have changed. And sometimes when you see that the problem that I used to manage it well, but now I can't be able to manage. Like my mental faculties have now went down that I can't be able to manage this problem. That is the time you'll be able to say go. And the body. What I think our body tells us that there's something wrong. You can't be tired the whole day. You can't always be having pains in your body and not sleeping and feeling like, you know what, I'm not okay, I'm anxious, I'm not concentrating, I'm forgetting. The body is telling you there is something that you're going through and I'm trying to carry you, but I can't take you anymore. Let us not wait until now we are done and now we have been seen at an institution.
You touched on something that I would like you to elaborate on, which is you said you become forgetful, and that affects executive functioning, right? Like you become forgetful, you can't problem solve anymore, and what is it, because you're overloaded, or because those are things that come naturally? So what happens when if you have a mental health breakdown or an illness or an episode, why does that happen?
Well, let's look at an example. As an example, stress. Stress is only beneficial if it can help you to push until you get things done. But when you have chronic stress, it leads to the chemical imbalances in the brain, rising of the stress hormone cortisol, that will now lead the brain to kind of like shut down the brain that is responsible for executive functioning, which is our prefrontal cortex. It shuts down. So if you cannot be able to use that brain, what is going to happen? And it's going to destroy certain memory neurons that we have in a brain that is responsible for memory, or hippocampus. So that on its own, it does all of these things in the brain. How do they manifest? They start manifesting what those things, that the concentration is poor, I can't think, I forget things and all of that. But if we can,
Emotions sometimes can be a mess.
They can be a mess. But what is the root? Something caused the stress.
So guys, sometimes you would think you are outgrowing. No. You have a problem. So consult.
Yeah.
Consult. Sometimes you're not outgrowing behaviors. It's because you are having a problem.
Yeah.
So consult. And you know how I'm saying consult because sometimes you might really be outgrowing, but you are not qualified to know that. This is where consulting comes in. So
definitely sit down with an expert.
Yes.
and be able to tell them.
Yeah.
I'm not saying that we're going to diagnose everything as a mental illness or a mental disorder.
Yeah.
But you need to sit down with someone like, hey, is this thing normal? And so I'm like, yeah, it is
Yeah,
normal.
and it's thank you for mentioning that because people, when you talk about psychiatrist or maybe a therapist, they think I am gone, I'm gone. You see, so
And
sometimes
when
you are
you
not
start
gone,
with
you come back.
medication,
And
man,
also
oh.
they don't realize that it's actually a solution to a, I don't know, our vernac, we failed. I don't know, they failed as those people that were making
The
languages
terminology,
because we don't have anxiety disorder, we don't have anxiety, we don't have depression, we don't have those things.
So
So
in our vernacular, so
yeah.
that we can be able to express it.
yeah, so this is where medical professional comes in
Yeah,
to
to
help
give it a
us deal
lingo.
with it. Just because we don't have the word anxiety, it doesn't mean we don't have the concept of anxiety. We have it.
I heard something that is so disturbing. Someone actually said, so mental health disorders are for the privileged.
You see, that's
If you don't have the resources to deal with it, you don't have it.
yeah, that comes from the not consulting. You know, if you go to a community and then no one ever consulted, so it means no one has depression because no one was ever diagnosed. So they think everyone there is mentally fit, but no, it's because people are not diagnosed.
And I think that's why I'm so passionate about mental awareness, mental health awareness, and to go and educate the people, educate the community about this. I think this is so personal to me. I was in a church with the ladies and I was trying to educate them this thing. And the cry that older people, they start to say, Doctor, I did not know that is a disorder. I did not know that was being ill. I thought it was normal. Why, like you said, I only thought that we have to see psychiatrists if the screws have fallen, you know. And I can't go and see those people because if I see them, it's going to be like I'm crazy. You know, that's what they attach to it. When a psychologist you what
Yeah.
you know, all those things, it means what, and it means what, it means what. I think the lingo and the stigma in our community, but the most powerful stigma that stands at the door to make sure that you don't get help is the self-stigma. It's having to accept that what I'm having is now a problem and I need help. It will prevent you even from seeking help early.
Guys, this was jam-packed, right? And just a little disclaimer, remember, this is not medical advice, but I think today, but it's for educational purposes. And remember, please to like, comment, subscribe, share. Someone that you know might need this, even if it's not you, but it might be you because South Africa and Ragoa. So where can people find you?
Oh, in what way?
If say they want to talk more, they want to.
You have any social
do you
media
have social
plug?
media? If maybe you're sharing this online.
Well, I don't own any private practice. I'm not doing any visual consultation or doing anything like that. I'm just solely serving public. Okay. So I don't do anything outside of that.
So people can't find
Yeah, so the only thing I do is maybe on my TikTok, on my social media accounts, that's when I used to educate, you know, and use those platforms to try to, you know, I think my main passion is to give people language and to clarify those terminologies that people think, what is a borderline personality disorder? I just want to clarify those terminologies and help people to be able to get the lingo and they can be able to use the correct language to explain. Because if you can know the language, you can be able to explain. Sometimes one word can explain how I feel. Yeah. I don't know what I mean. Let me help you to be able to gain the language.
Yeah.
And so I use my public platform.
Let me
there.
tell you what you really mean
Yeah.
when you say takani.
So what are those public platforms?
I'm just using I think in my, it's Lobese Tabang everywhere, in my Instagram, my TikTok, my Facebook. That's where I use it mostly, just to help people, please. There's whatever that you're feeling is called this. Yeah.
Any final closing remarks that you would have for our viewers?
You know, what I think I'll say this one word. What started as a solution and has now became a problem. What you were trying to borrow a happiness and now has become a nightmare and a torture it is now a time to be able to go back and say, you can see us in clinics, in our hospitals, in public, free of charge, and we're going to be able to help you to say, I think what you're having is 1, 2, 3. Do you know the relief that you'll get? Diagnosis is a 90% freedom. If you can pinpoint the problem, you can fight it. You don't have to suffer alone.
Okay.
I don't want to mess it up.
Alright,
It's sharp. It's sharp.
I'm obviously gonna. Me too. Guys, if you can't name it, you can't heal it.
Yeah.
So,
Yep.
from myself,
Yeah.
From your boy,
Myths.
Kavid Wings.
dog. Say anything.
I don't like. I don't because I don't use a lot of what is currently. Yeah.
Millennials.
Okay. Yes. Okay. From Dr. Lobese, please take care of your mental health and please be kind. Be so kind with yourself.
As well as to others, guys.
Yeah.
And it is goodbye.
Ciao.